Falls are not an inevitable part of aging, but they are becoming dangerously common among women over 60. What might shock you is that the majority of these falls aren't caused by slippery surfaces, poor lighting, or medical emergencies. According to geriatric specialists and physical therapists who work exclusively with older adults, nearly 99% of balance problems and falls in senior women can be traced back to 6 specific walking mistakes that develop gradually over time and often go unnoticed until it's too late if you've noticed that you feel less steady on your feet than you used to, if you've had any close calls or minor stumbles recently, or if you find yourself reaching for walls or furniture more often when you walk. This information could be life-changing. The walking patterns you developed decades ago may no longer serve your changing body, and continuing these habits is putting your independence and safety at serious risk. Dr. Mary Tinetti, a geriatrician at Yale School of Medicine, who has spent over 3 decades studying falls prevention, emphasizes that most falls in older women are predictable and preventable. Her research, along with studies from the American Geriatric Society, shows that simple modifications to how you walk can reduce your fall risk by up to 85%. The key is understanding what these dangerous walking patterns look like and knowing how to correct them before they lead to injury. Physical therapists who specialize in geriatric care report seeing the same walking mistakes over and over again in their patients. These aren't obvious problems that you'd immediately notice. They're subtle changes that happen gradually as our bodies adapt to aging. Changes in strength, flexibility, and confidence. But while these adaptations might feel natural or even protective, they actually increase rather than decrease your risk of falling. Before we examine these 6 critical walking mistakes, it's important to understand why walking becomes more challenging as we age, especially for women. After menopause, declining estrogen levels affect bone density, muscle mass, and joint health. Our inner ear, which helps control balance, becomes less sensitive. Our vision changes, affecting depth perception and our ability to see obstacles clearly. These are normal parts of aging, but they require us to adapt our movement patterns rather than simply accepting increased fall risk. The first and most dangerous walking mistake that geriatric physical therapists observe is what they call shuffle walking, taking very short, shuffling steps instead of lifting your feet properly. This walking pattern often develops gradually when women begin to feel less confident about their balance, thinking that keeping their feet closer to the ground will make them safer. Unfortunately, the opposite is true. Biomechanics experts explain that shuffle walking actually increases your fall risk significantly because it reduces your ability to recover when you encounter obstacles or uneven surfaces. When you shuffle, you can't step over or around unexpected obstacles. You can't adjust your stride length to accommodate changes in terrain. And you can't use your leg muscles effectively to maintain balance when you're challenged. Dr. Lynn Beatty, a physical therapist who specializes in fall prevention, notes that shuffle walking also leads to muscle weakness over time. When you don't lift your feet properly, you're not using your hip flexors, glutes, and core muscles effectively. These muscles become weaker, which makes you more likely to shuffle, creating a dangerous cycle that progressively increases your fall risk. The correct walking pattern involves lifting each foot clearly off the ground with each step, taking steps that are roughly the length of your foot, and maintaining a heel-to-toe rolling motion. Your arms should swing naturally at your sides to help with balance. This might feel less secure initially if you've been shuffling, but it's much safer once your muscles readjust to the proper pattern. The second critical mistake is walking with a forward head posture, where your head juts forward ahead of your shoulders. This posture often develops from years of computer use, reading, or household tasks that require looking down, but it becomes particularly problematic for balance as we age. Orthopedic specialists explain that when your head is positioned forward, it changes your center of gravity and puts enormous strain on your neck and upper back muscles. More importantly for balance, this posture affects your inner ear's ability to provide accurate balance information to your brain. Your inner ear works best when your head is properly aligned over your shoulders, allowing the balance organs to function optimally. Physical therapists who work with older women report that forward head posture contributes to what they call forward momentum walking, a pattern where women lean forward as they walk, as if they're being pulled forward by their head position. This creates a constant risk of losing balance forward and makes it much harder to stop quickly or change direction safely. The correction involves consciously pulling your head back so your ears are positioned over your shoulders. Imagine a string pulling the top of your head toward the ceiling while you gently tuck your chin. This alignment might feel awkward initially, especially if you've been walking with forward head posture for years, but it's crucial for maintaining proper balance. The third dangerous walking mistake is not using your arms effectively for balance. Many older women unconsciously hold their arms stiffly at their sides, cross them in front of their body, or keep their hands in their pockets while walking. Kinesiology experts, scientists who study human movement, explain that arm swing is crucial for balance and efficient walking, especially as we age. Your arms act as natural counterbalances when you walk. When your right leg moves forward, your left arm should naturally swing forward, and vice versa. This cross-pattern movement helps stabilize your torso and maintain balance. When you restrict arm movement, you lose this natural stabilizing mechanism and have to work much harder to maintain balance with just your legs. And Core.geriatric rehabilitation specialists observe that women who walk with restricted arm movement often develop compensation patterns that increase their fall risk. They might walk with a wider stance, take more tentative steps, or rely more heavily on visual cues for balance, all of which can be problematic in challenging walking situations. The solution is to allow your arms to swing naturally at your sides. If you carry a purse, consider using a crossbody bag that leaves your arms free to move. If you use a walking aid like a cane, make sure you're using it correctly so that your free arm can still move naturally. Practice walking with deliberate arm swing until it becomes automatic again. The fourth mistake that balance specialists frequently observe is walking too slowly and tentatively. While it might seem logical that walking slowly would be safer, research shows that walking too slowly can actually increase fall risk. When you walk very slowly, you spend more time balanced on one foot with each step, which requires more strength and balance than walking at a normal pace. Gait analysis experts explain that there's an optimal walking speed for stability that varies by individual but is generally faster than the very slow, cautious pace many older women adopt. Walking too slowly also means you're not using the natural momentum and rhythm that make walking efficient and stable. Instead, you're fighting against your body's natural movement patterns. Dr. Stephanie Studensky, a geriatrician who has extensively studied walking speed and health outcomes, found that walking speed is actually a predictor of overall health and longevity in older adults. Women who maintain a normal walking pace tend to have better balance, stronger muscles, and lower fall risk than those who walk very slowly. The goal is to find a comfortable, confident pace that allows you to lift your feet properly, maintain good posture, and use natural arm swing. This might mean gradually increasing your walking speed if you've become accustomed to walking very slowly. Start with short distances and gradually build up both speed and endurance. The fifth critical walking mistake involves looking down at the ground constantly while walking. This habit often develops when women become worried about tripping over obstacles. But paradoxically, it increases rather than decreases fall risk. Vision specialists and balance experts explain that constantly looking down disrupts your balance in several ways. First, looking down reinforces forward head posture, which we've already discussed as problematic for balance. Second, it prevents you from seeing obstacles and hazards that are farther ahead, giving you less time to plan your steps and navigate safely. Third, looking down reduces your awareness of your body position in space, making you more likely to lose balance. Occupational therapists who work with fall prevention recommend what they call scanning vision, looking ahead about 10-15 feet, while occasionally glancing down to check for immediate obstacles. This allows you to plan your path, maintain good posture, and use your peripheral vision to stay aware of your immediate surroundings. The technique involves practicing walking while consciously keeping your head up and eyes forward. Start in familiar, safe environments and gradually build confidence in your ability to navigate without constantly watching your feet. Remember that your feet are generally quite good at finding safe places to step when your brain is planning ahead effectively. The sixth and perhaps most overlooked walking mistake that balance specialists observe is wearing inappropriate footwear or failing to replace worn-out shoes. Podiatrists and geriatric specialists report that foot problems and improper footwear contribute to more falls in older women than almost any other single factor. Yet it's something many women don't consider when thinking about their balance and safety. As we age, our feet change significantly. They may become wider, develop bunions or other deformities, lose fat padding, or experience changes in arch support. Shoes that fit perfectly 10 years ago may no longer provide the support and stability your feet need. Additionally, the rubber soles on shoes wear down over time, reducing traction and increasing slip risk on smooth surfaces. Dr. Hilton Menz, a podiatrist who researches footwear and falls in older adults, has found that women wearing shoes with heels higher than 1 inch, shoes with inadequate support, or shoes with worn treads are 3 times more likely to fall than those wearing appropriate footwear. Even small heels or wedges that once felt comfortable can become dangerous as your balance and stability change with age. The characteristics of safe walking shoes for senior women include a low, broad heel, no more than 1 inch high, a sole that provides good traction on various surfaces, adequate arch support, a secure fit that doesn't allow your foot to slide around inside the shoe, and enough toe room to prevent cramping or pressure. Athletic shoes or walking shoes often meet these criteria better than dress shoes or fashion footwear. Many women resist giving up their favorite shoes, especially dress shoes for special occasions. But balance experts emphasize that no outfit is worth the risk of a serious fall. If you must wear heels or less supportive shoes for special events, limit the time you spend walking in them, use handrails whenever possible, and consider bringing comfortable shoes to change into for walking longer distances. Now that we've covered all 6 walking mistakes, let's discuss how to systematically correct these patterns and rebuild confident, safe walking habits. Physical therapists who specialize in geriatric care recommend approaching these changes gradually and systematically, rather than trying to fix everything at once. Start with posture correction, as this forms the foundation for all other improvements. Several times throughout each day, check your head position and make sure your ears are aligned over your shoulders. Practice this while standing still first, then while walking short distances in your home. Use mirrors to check your posture and ask family members to remind you gently when they notice you reverting to forward head posture. Work on foot lifting and step length next. Practice marching in place, lifting each foot clearly off the ground and placing it down with intention. Then practice walking while consciously lifting your feet and taking steps that are roughly the length of your foot. Start with just a few steps at a time and gradually increase the distance as the pattern becomes more natural. Arm swing can be practiced while standing still initially. Let your arms hang naturally at your sides, then practice the cross pattern movement. Right arm forward when left leg goes forward, and vice versa. Once this feels comfortable, incorporate it into your walking practice. If you've been restricting arm movement for a long time, this might feel awkward initially, but it will become natural with practice. Walking speed adjustments should be made gradually. If you've been walking very slowly, increase your pace slightly each week rather than trying to walk normally immediately. The goal is finding a pace that feels confident and sustainable, while allowing you to maintain good posture and proper foot lifting. Vision training involves practicing looking ahead while walking in safe, familiar environments. Start by walking a path you know well, while consciously keeping your head up and eyes focused about 10-15 feet ahead. Gradually practice this technique in new environments as your confidence builds. Balance and strength training exercises can significantly support these walking improvements. Geriatric physical therapists recommend specific exercises that target the muscles and systems most important. For balance and walking safety, single leg. Standing is one of the most effective balance exercises for older women. Start by standing behind a sturdy chair and lifting one foot slightly off the ground while holding the chair back lightly for security. Work up to holding this position for 30 seconds on each foot, then progress to doing it without holding the chair. This exercise strengthens the small muscles in your feet and ankles that are crucial for balance. Heel-to-toe walking, also called tandem walking, helps improve dynamic balance and coordination. Place one foot directly in front of the other, heel to toe, and take several steps in a straight line. Start next to a wall or railing for security, and gradually progress to walking without support. This exercise mimics the balance challenges you encounter in real-world walking situations. Calf raises strengthen the muscles that help lift your feet and provide push-off power when walking. Stand with your feet hip-width apart and rise up onto your toes, then lower slowly. Start with 10 repetitions and gradually increase as you get stronger. Strong calf muscles are essential for proper foot clearance and reducing trip risk. Hip strengthening exercises are crucial because hip weakness is a major contributor to shuffle walking and poor balance. Side-lying leg lifts, standing hip abduction, lifting your leg out to the side, and mini squats all help strengthen the hip muscles that keep you stable and allow for proper step length. Core strengthening supports good posture and overall stability. Simple exercises like seated or standing marching, modified planks against a wall, and gentle twisting movements can help. Strengthen your core without requiring you to get down on the floor. Environmental modifications in your home can support your walking improvements and reduce fall risk while you're building better walking habits. Remove throw rugs or secure them with non-slip backing. Ensure adequate lighting in all walking areas, especially hallways and staircases. Install grab bars in bathrooms and along stairs. Keep frequently used items at accessible heights to avoid reaching or bending while walking. Regular foot care becomes increasingly important for safe walking as you age. See a podiatrist regularly if you have foot problems. Keep toenails trimmed properly. Check your feet daily for changes or problems, and address any foot pain promptly. Foot pain causes compensatory walking patterns that increase fall risk. Professional help should be sought if you're concerned about your balance, or if you've had any falls or near falls recently. Physical therapists who specialize in balance and fall prevention can assess your specific walking patterns and provide personalized exercises and strategies. Occupational therapists can evaluate your home environment and recommend modifications to improve safety. Don't wait until after a fall to address balance concerns. Many older women dismiss balance problems as a normal part of aging, but research clearly shows that proper intervention can maintain and even improve balance throughout the aging process. The sooner you address walking mistakes and balance issues, the more effective interventions tend to be. Tracking your progress can help maintain motivation and identify areas that need more attention. Keep a simple log of your walking practice, noting improvements in confidence, balance, or endurance. Celebrate small victories, being able to walk to the mailbox with better posture or navigating a crowded store more confidently are significant. Achievements. Regular practice is essential for making these changes permanent. Plan to spend 10-15 minutes daily working on walking technique and balance exercises. This might seem like a lot initially, but consider it an investment in your independence and safety. The time you spend now practicing proper walking technique could prevent a fall that would require weeks or months of recovery. Remember that improving balance and walking safety is not about returning to your younger self. It's about optimizing your current abilities and adapting to your body's changing needs. Every woman's balance challenges are different, and solutions should be tailored to individual needs and limitations. The goal is confident, safe mobility that allows you to maintain your independence and continue doing the activities you enjoy. Whether that's walking in your neighborhood, navigating stores and restaurants, or traveling to visit family, proper walking technique and good balance are essential for maintaining quality of life as you age. Most importantly, don't let fear of falling lead to activity avoidance. While it's important to be cautious and make appropriate safety modifications, staying active is crucial for maintaining the strength, balance, and confidence that prevent falls. The more you practice proper walking techniques, the more natural and automatic they become. Your balance and walking ability are not fixed. They can be improved at any age with proper attention and practice. The 6 walking mistakes we've discussed are common, but they're also correctable. By addressing these patterns systematically and consistently, you can significantly reduce your fall risk and maintain your mobility and independence for years to come. If this information has helped you understand how to walk more safely and confidently, please give this video a thumbs up and subscribe for more health and safety content specifically designed for women over 60. Your mobility and independence are precious, and protecting them is always worth the effort. Have you noticed any of these walking patterns in yourself? And which corrections do you think will be most challenging for you to implement? Share your experiences in the comments below. Your insights could help other women who are working on improving their balance and walking safety. And if you're interested in more content about maintaining strength and independence as you age, be sure to check out our video about the simple exercises you can do at home to prevent falls. Remember, every step you take toward better balance is a step toward continued independence and confidence.